having great conversation. Of course, we're with Dr. Edward Sang. He is an orthopedic and trauma surgeon, and we're trying to make sure that we're also good patients, not just looking for good doctors, right? It goes both ways.
Daktari ashanikata 2.5.
Tuma.
Amefanya tu consultancy ya nini ya magoti hapa, ameniambia it's not a problem. Ameshanikata 2.5. But of course, it's exciting to have a conversation with him on and off air. Mariam, you had a question?
True. There's a lot of the times we have what we think, and he was talking about Dr. Google earlier, and those are the things that we brush off, especially, I don't know, if it's an African thing, we think everything can be cured with ginger, honey, lemon, or mwarubaini.
And everything is malaria.
And everything is malaria, right? What are the common misconceptions that you encounter in your field? Myths, misconceptions?
I'll zero in to hip and knee replacement, especially in the elderly, because it pains me to see old guys having difficulties in walking, moving around, doing basic. If somebody takes away your ability to do the basic things, like take a shower, go to the kitchen, get a cup of coffee, then they've really messed up your life. So most people would say that's in bear with it, as in hiyo ni uzee tu, vumilia, as in uzee inakuja na shida zake. But that should not be the case. As in, especially, God forbid, if my kids refuse that I get surgery when I'm old because I can't move around. But the thing is, these things are manageable. As in, when you're old, you need to be very comfortable. You need to be able, you've worked for all these years. And then where we come in to make you comfortable. If your knee has a problem, if it's replaced, you'll feel better. There's nothing like this patient is too old for surgery. Especially, yes, they're fragile patients. There are issues that have to be considered, like health-wise. But there's something that can be done to make you move better, to make you do your things better, and at least make your sunset years feel better and comfortable.
Yeah, we were just having a conversation way before we started the interview. Talking, just throwing in a fact about something that happens maybe in some of the sports where they surgically elongate maybe a bone here because they would like you to be slightly taller. It's really common with the NBA. And it so happens that they do that when people are very young. And you've talked to us about how sometimes it's not an issue because to them it becomes more like a lifestyle, but they get tear and wear due to injury. But as soon as something that like that happens, and maybe you're taking care of someone who's going through this phase, are there like special treatments that you should give to these patients, especially maybe you're at home with your parent and they're going through they've just been operated upon? Do you have like special care for them or options that you can actually just throw off your list and just give people advice?
Yeah, I think we if we look at this in three phases. One is the issue before. Then if now we decide you like we'll basically let's just stick to arthritis because the subject is quite wide. So with arthritis, let's say a patient comes in with knee pain, stiffness. Those are the early symptoms: knee pain, stiffness, difficulty in moving up and down. Then you see a doctor. The first thing is to give them information on what you're suffering from. Then these are the options that can be done because not all patients with arthritis will need surgery. Then there are basic things like you lose weight because weight affects your knees, it affects your hips, makes your arthritis worse. Some people have lost weight and their pain the pain levels have gone down and they've been able to do their own stuff, as in they don't necessarily need surgery. So there are first is patient education, know what you're suffering from. Then second is now non-medical management. That means like if you're having knee pain, then you can use a walking stick, which will make it easier for you to move around. You can use braces to support the joints that are paining. We can take you to physiotherapy. There's lifestyle modification. We can change your shoes. We advise you on the appropriate shoe wear. Then we send you to centers where they do physical therapy. It helps your joints move better. Then some patients stop at this point. They get better. They don't feel they need surgery. Then those ones, then we discharge them at that point. Then there's a group now that moves now to the medical bit, where now we have now pharmacological management, where we give medication depending on, we start with the mildest to the strongest medication, depending on how the patient is. Then after that, there are some patients we inject steroids into the joints to control the pain. Then there are substances called viscosupplementation, where we inject some fluid in the joint. it makes it better, but these are not permanent treatment. But some patients do well with that. Then if that doesn't work, then we escalate to surgery. Now surgery.
So you just surgery is not like the first option. You have to be taken through so many processes before they decide.
90% of the time, surgery is the last option. Although we are paid to cut, but surgery is normally the last option. But then after surgery, there's care, because we can't just operate on you and dump you. Because then you have a new joint here, an artificial joint.
Yeah.
We have to train you on how to use it. And this joint just functions as good as the native joint. The only thing is that it cannot live as long as what God made, but it will serve you. You'll have no pain. You can cycle. You can swim. You can do. The only thing you can't do is run a marathon. But who would want to run a marathon at the 90s?
Or go through a metal detector.
So my cousin teach you imeharibu hesabu kabisa. Hakuna kukiwin nini 17 million in 7 minutes.